I'm going to do my newborn physical assessment. So first thing we need to do is make sure baby stays warm. Babies aren't very good at thermoregulating. They can lose heat through 4 ways. Those are evaporation, conduction, convection, and radiation. Evaporation is when amniotic fluid dries or evaporates off the newborn. Conduction is body heat transferring to cooler objects that the newborn is touching, like a table or a towel that hasn't been warmed. Convection is losing heat to the surrounding cool air. And radiation is losing heat through something that actually isn't touching the newborn, like a window. So we made sure to dry off the baby good. He's under a warmer with a warm blanket away from any vents or windows. So we checked his vital signs. The normal temperature for a baby is 97.7 to 99.3. His temperature was 98. The heart rate varies. When they're asleep, it can be as low as 100 beats per minute. When they're awake, it can be 120 to 160, and when they're crying, it can be up to 180. The respirations should be between 30 to 60 breaths per minute. And when you're measuring respirations, you need to watch for a full minute, because they have what's called periodic breathing, where they will stop breathing for 15 seconds at a time. So his respirations were 40 breaths per minute. And blood pressure is not routinely taken unless they suspect like a cardiac problem. But normal systolic blood pressure should be 50 to 75, and diastolic should be 30 to 45. So his blood pressure was 60/40. So his vital signs were all within normal limits. What we do first when assessing a newborn is APGAR score. So the APGAR score is taken at 1 minute and then again at 5 minutes. It measures appearance, pulses, grimace, activity, and respirations. So an APGAR score between 7 to 10 is ideal. That indicates the newborn is in good health. An APGAR score of 4 to 6 indicates that the baby needs some help. So maybe suctioning, stimulation, maybe oxygenation. And a score of 0 to 3, the baby is in serious danger, so they need immediate resuscitation. We did not have to do a Ballard score today. A Ballard score is a tool to determine gestational age of a baby. It's used more on like post-term, preterm, really small babies, really big babies, for babies that didn't receive prenatal care. So what I'm going to do is, before touching the baby, I'm going to observe it. I'm going to look at his skin color and his respirations. So his skin color is pink except for his hands and his feet. That is called acrocyanosis. They are blue colored, which is normal for the first 24 to 48 hours. It is due to immature peripheral circulation. And I don't see Harlequin sign. Harlequin sign is when half of the body of the newborn is a bright red and the other side is just normal skin color. And as I'm looking at his respirations, he has even movement of the chest and abdomen. He doesn't appear to be in respiratory distress. A baby in respiratory distress would have nasal flaring, retractions, grunting with expiration, tachypnea, dyspnea. So he is not in respiratory distress. What helps newborn babies breathe is surfactant. Surfactant is a fluid in the lungs that reduces surface tension, so it actually allows the alveoli to stay open in order for them to breathe. Okay, I'm going to go ahead and look at his head. Going to look at the suture lines first. So I see that his suture lines are overlapped. This is from regular molding of the head due to him coming through the birth canal. And I'm also going to check for his fontanelles, also called soft spots. So in the front of his head, he has a diamond-shaped fontanelle. This should close by 18 months. And on the posterior side, he has a triangular-shaped fontanelle. This should close by 2 months. And they are both flat, which is a good sign. If they were to be bulging, that would indicate increased intracranial pressure. If they were sunken, that would indicate dehydration. So we look at the suture lines to assess for any birth trauma. Some birth trauma that you may see on the head is caput, which is swelling of the head that crosses the suture lines. This is from pressure within the uterus and in the vaginal wall. Or you could also see cephallohematomas, which is swelling of the head that does not cross the suture line. It's from ruptured blood vessels between the skull and the periosteum. I'm going to check his eyes. So his eyes are symmetrical with no drainage. I don't see any yellow or red tint. I'm going to check his ears, and they are symmetrical with no drainage. I'm going to check his nose, and his nares are symmetrical with a little bit of clear drainage, which is normal because he's been in fluid. And I'm going to look at his mouth. His mouth is pink. With a gloved hand, I'm going to put my finger in his mouth. Make sure there is no tongue tie, no lip ties. I'm going to feel that his palate is intact. I'm going to feel his gum line, make sure there's no teeth. You may feel Epstein pearls, which are papules on the roof of the mouth or on the gum line that were formed when his palate was closing. And those are normal, they will go away. So I don't feel any of that. With my finger in his mouth, he is sucking. So that's a positive sign for the suck reflex. And if I put my finger a little farther back, he will gag, which is positive for the gagging reflex. And I'm just going to stroke his cheek. And he turns his face towards my finger where I'm stroking. So that's positive for the rooting reflex. And as I'm looking at him, I see a little bit of milia on his nose, which is normal. It is just occluded sebaceous glands filled with keratin. Now I'm going to go down and look at his clavicles. I'm going to make sure they're not broken. Okay, they are not broken. Looking at the chest, there's some breast engorgement, which is normal. It's just enlargement of the breast due to the maternal hormones, and that will go down. I'm going to look at the umbilical cord. The umbilical cord has 2 arteries and 1 vein. The vein carries the oxygenated blood, and the artery carries the deoxygenated blood. On the outside of the umbilical cord is the white gelatinous substance that's called Wharton's jelly, and that just protects and supports the vessels inside the umbilical cord. I'm going to feel his belly. It is soft and not distended. I'm going to grab his hands, and he grasps my fingers, which is positive for the palmar reflex. I'm going to check his cap refill on both sides. That was less than 2 seconds. I'm going to feel both his pulses on both sides, and they are both strong and even bilaterally. I'm going to go ahead and feel his femoral pulses, and they are both strong and even bilaterally. I'm going to do 2 maneuvers to check to see if he has hip dystocia. So if I were to do this and I would hear a click or a pop, that would be positive for hip dysplasia. Now I'm going to come down to the feet, check the pulses They're both strong and even bilaterally. Check the cap refill, less than 2 seconds. I'm gonna stroke his foot upward and his toes fan out. So that is positive for the Babinski reflex. And I'm going to put my finger just under his toes, and he grasps my finger with his toes, which is positive for the plantar reflex. I'm going to pick baby up, and if I kind of just tilt him, his hands come up. So that is positive for the Moro or startle reflex. I'm going to turn him around, check his back. His spine is straight. I don't see any dimples or tufts of hair on the base of his spine, which would indicate spina bifida. His gluteal folds are even. If they were uneven, that might indicate hip dysplasia. I'm gonna go ahead and turn him back over. So I see he has a little bit of vernix in his folds, in his armpit and in his thigh folds. Vernix is just a white coating on the skin. It was there to protect his skin from when he was in the amniotic fluid. And he has just a little bit of lanugo, which is very fine downy hair that helps the baby to stay warm. You'll see more of it in a preterm baby. I didn't see any skin abnormalities. Some things you may see are things like stork bites, which are dilated blood vessels. They are flat and they appear red or pink. You may see a strawberry hemangioma, which is a clump of blood vessels that's dark red. Port wine stain is from abnormally formed blood vessels. They appear flat and they're kind of like a wineish color. They're reddish purple. And Mongolian spots are trapped melanocytes under the skin. They are flat. They are flat and they appear like a bluish grayish color, usually on the back or the buttocks, and you need to make sure to report these because they can look like bruises. So now that I have looked over everything, I'm gonna go ahead and listen. Going to start with listening to his lungs. And his lungs are kind of wet crackles, but that is normal for the first 24 hours because he's been in fluid. I'm going to listen to his stomach. And his bowels are active in all 4 quadrants. Now I'm going to listen to his heart. Okay, heart sounds are normal with no signs of a murmur. You may hear abnormal heart sounds if his shunts weren't to close. So a baby, when they're in utero, they have 3 shunts in their heart. They should close as soon as he is born and the umbilical cord is clamped off. So the first one is the ductus arteriosus. This allows blood to bypass the fluid-filled lungs by shunting blood from the pulmonary artery to the aorta. The next one is the ductus venosus. It shunts a portion of the left umbilical vein blood flow to the inferior vena cava, allowing blood to bypass the liver. In the foramen ovule is an opening that allows blood to flow directly to the right atrium and bypass the lungs. Couple more things. I'm going to turn baby's head towards me, and his arm and leg on the same side should both extend, which is positive for the tonic neck reflex. And as I was assessing him, I did not see any signs of synodactyl, which is fingers or toes that are fused together, or polydactyl, which is extra fingers or toes, or the simian crease, which is the crease all the way across the palm, which could indicate Down syndrome.